events. Okay, the cardiac cycle depends on two factors, two loads acting on the heart. One is called preload, the other one is called afterload. What is a preload? Preload, before the action begins, some load acting on the heart is called preload, is venous return. These are all Viva questions. Venous return is the example for the preload. Afterload, peripheral resistance is the example for the afterload. These two loads are very important loads acting over the heart. Okay? This is the definition of the cardiac cycle. What is the definition, Nana? Cyclical changes that takes place in the heart during each beat. Mari beat lo contraction undi, relaxation undi. Contraction is called systole. Relaxation is called during systole, blood goes from where to where? Atria to ventricle. During ventricular contraction, blood goes from where to where? Ventricles to pulmonary artery and aorta. So volume wise so many changes are taking place. Pressure wise so many changes are taking place. Am I right? During systole and during diastole, some sounds are produced, heart sounds are produced meantime. ECG changes are occurring during each beat. These all together called cardiac cycle. Cyclical changes from one beat to other beat, pressure wise, physically, and pressure wise, volume wise, in all the blood vessels. What are the changes that are happening is called cardiac cycle. ఇలా ఉంటుంది cardiac cycle. ఈ డయాగ్రామ్ వేయాలి cardiac cycle వస్తే. కన్ఫ్యూజ్ అవ్వద్దు, చాలా సింపుల్ డయాగ్రామ్ ఇది. ఫస్ట్ మీరు ఏం చేస్తారంటే ఇలా వేయండి లైన్, వన్ లైన్, సెకండ్ లైన్, థర్డ్ లైన్ అండ్ ఫోర్త్ లైన్. ఇందులో ఒక క్వశ్చన్ ఉంది, చాలా ఇంపార్టెంట్ క్వశ్చన్, మల్టిపుల్ చాయిస్ క్వశ్చన్. వాట్ ఈస్ ది డ్యూరేషన్ ఆఫ్ ది కార్డియాక్ సైకిల్? అంతే కదా, దాని కెపాసిటీ 1, 2, 3, 4, 5, 6 ఈస్ ఎ వెరీ ఇంపార్టెంట్ క్వశ్చన్. Viva question. 0.8 seconds is the duration of the cardiac cycle. ఈ cardiac cycle లో రెండు ఈవెంట్స్ ఉన్నాయి, atrial events and ventricular events. What is that, Nana? Atrial events and ventricular events. Atrial events are atrial systole and atrial diastole. Ventricular events are ventricular systole and ventricular diastole. ఇక్కడ చూడండి, atrial events చూడండి, atrial events 0 to 0.1, 0 to 0.1 and అక్కడ నుండి atrial systole, ఇక్కడ atrial systole 0.1 second. From there ఇదంతా రిమైనింగ్ 0.7 second is the atrial diastole. What is the duration of atrial systole? What is the duration of atrial diastole? 7 seconds. Okay, now coming to the other one, ventricular systole. And the duration enta? Immediately after atrial systole, ventricular systole begins, which is depicted down. The duration is 0.3 seconds and ventricular diastole 0.5 seconds. ekkadiki chusna 0.8 ki match avali. Where you see even atrial events or ventricular events, they should match to 0.8 seconds. Okay, ఇది తర్వాత వేసుకోండి. Later you draw this diagram. In exam you should draw this diagram definitely. ఇది ఏంటి చెప్పండి నాన్న, what is this? ఇక్కడ show me where is atrial systole.
అంతే అట్లానే దాని
atrial systole ఎక్కడ ఉంది? ఇది ventricular systole నాన్న.
ventricular systole.
Right. Atrial systole 0.1 second. Atrial diastole 0.7 second కదా. And ventricular systole, ventricular systole 0.3 second. Ventricular diastole 0. ఈ atrial systole లో what are the divisions are there? What divisions are there? These all are atrial diastole, rapid ejection phase, isovolumetric contraction, last rapid filling phase of the ventricle. Remember, when you are talking clinically, Contraction means systole means it is only contraction of the ventricle, not the atria. Ardhamainda? You are talking about the contraction. Contraction of what? Ventricular. We are not considering atria. You are talking about diastole. Diastole of what? Diastole of what? Ventricular diastole, not the diastole of the atria. Clinically I am talking. ఇవన్నీ ఏంటి? వాట్ ఆర్ ఆల్ దీస్ డిఫరెంట్ నేమ్స్ ఆర్ దేర్? అండ్ ఏడబ్ల్యూ ఓపెన్, ఎస్ఎల్వి ఓపెన్, H4, HS3, SLV open, these all are, and subdivisions of the ventricular systole and ventricular diastole. Subdivisions of ventricular systole and ventricular diastole. We'll begin with atrial systole. What is the meaning of atrial systole? Contraction of the atria. What happening during the contraction of the atria? What happens? Atria contracts, small amount of the blood enters the... Ante kada? Yeah. Now, what is the next two stages, man? Isometric contraction, ejection period. These two are the subdivisions of the ventricular systole. These three are the subdivisions of the ventricular diastole. Protodiastole, isometric relaxation, the other one called rapid and slow filling are these subdivisions of ventricular diastole. We'll see one by one. What is atrial systole? You told me already. Atrial systole, contraction of the atria, small amount of the blood entering into the ventricle. How much amount of the blood? 25% of ventricular filling occurs due to atrial systole. This can be a last phase of ventricular diastole, and which also produces the fourth heart sound. Which also produces the... How many heart sounds are there? How many are there? Not 5, not 2, 4 heart sounds are there. Okay, due to rushing of the blood from atria to ventricle, some sound will come, which is a fourth heart sound, cannot be heard with this one, what do you call, stethoscope, and it can be taken up by the phonocardiogram. A specialized instrument for heart is called phonocardiogram. So this is what and which produces the fourth heart sound. And atrial diastole, gradual filling of the atria by the great veins. What are those great veins? Superior vena cava and inferior vena cava. So I am not bothered about atrial events. I am not interested about atrial. Okay, I explained. But I will focus only on ventricular events. Clear? Atrial events are over? Only one important point under atrial events, fourth heart sound is produced. What heart sound is produced, ma'am? Correct. Yes, ventricular systole. What is the meaning of ventricular systole? Contraction of the ventricle. If the ventricle is getting contracted, where the blood goes? Blood goes into pulmonary artery and aorta. And ventricular systole will have some phases, I told you. What are the phases, ma? Isovolumetric contraction. What is the duration of it? Next one. Maximum ejection, duration, and reduced ejection. Altogether, what is the duration? It should match to 0.8 seconds. Match to 0.8 seconds. Am I clear? Right. Now, out of the three phases, we are talking about isometric contraction period. Same. The meaning of the iso is same. Contraction. What contracting? What are contracting? Ventricles are contracting. Okay, so all the valves, at the time of ventricles are contracting, both the valves, semilunar valves are closed up, atrioventricular valves also got closed for milliseconds. for millisecond. అప్పుడు ఏమవుతుంది? What happens in the pressure in the ventricle? What happens to the pressure to the ventricle? And now the ventricle become closed chambers. No change in the volume of the blood. Blood lo change, volume lo change ledu, and pressure increased by the time. The increase in the building up of the pressure in the ventricles is called isovolumetric contraction. We are talking just increase in the pressure. akkada varake maatladutunna. This is what are you calling isovolumetric contraction? What are the changes are happening, ma? And it is a small period between closure of AV valves and opening of the semilunar valves. Ventricles contract as closed chamber. No change in the volume of the blood occurs, and intraventricular pressure raises. Is known as isovolumetric contraction. దీన్ని మనము isometric contraction. Clear? Is this clear? Everyone? Now we'll go for second one. Maximum ejection phase, number 2. Maximum. And in the previous stage, pressure was more. When the pressure is more, where that blood should go? From high pressure to low pressure. Due to that pressure gradient, semilunar valves open up. Semilunar valves open up. Intraventricular pressure is more, semilunar valves are forced to open. So due to pressure gradient, blood is ejecting out of ventricle. 2/3 of the stroke volume is ejected. Maximum amount of the blood. Ipudu dam open cheyagane how the water is rushing, in the same way semilunar valves are open up, and the amount of the blood in the ventricle rushing into the aorta and pulmonary artery, maximum 2/3 will go, and remaining 1/3 of the stroke volume with low speed, later part it will enter into the aorta and pulmonary artery. That is known as reduced ejection. 3 periods are isovolumetric contraction is over, maximum ejection is over, reduced ejection is over. These 3 are the divisions of what? Ventricular systole, ventricular contraction. Am I right? Right, ma? Yeah. What comes next? Ventricular diastole. What is the meaning of the diastole? Relaxation of the ventricles is done under what headings? 5 phases are there. Protodiastolic period. Duration ma? Isovolumetric relaxation. Duration? And rapid inflow. Duration? And diastasis. Duration? And atrial systole. Duration? All together it is a duration of 0.5 seconds. 0.5 seconds. That's right. It is a duration of ventricular diastole. I am just focusing on ventricular activities, not atrial. Okay, we'll see one by one. What is the first phase, Nana? First stage of the diastole, semilunar valves are closed at the end of this period. Antena? Semilunar valves are closed, ventricles are relaxing, intraventricular pressure is less than the pressure in the aorta and pulmonary artery. Semilunar valves are closed. So why they are closed, semilunar valves? Because to prevent the backward flow of the blood from 8 arteries into the ventricle. That's why they are closed. Closure of the semilunar valve producing here a sound called, what is the sound, ma? Second heart sound. They ask you in the exam, what is the cause for the second heart sound? Production of the second heart sound. Closure of the semilunar valves. Okay, so this is what is the stage? Diastolic phase. What is the phase, Tana?
1 GB.
Now, isometric contraction was the previous one. In contraction, isometric contraction. Here, isometric relaxation. All the valves are closed. ventricles undergo isometric relaxation. Pressure in the ventricles is reduced. Once the pressure in the ventricles is reduced, what is happening now? Yeah? Correct. No change in the volume of the blood in the ventricle. Intraventricular pressure drops. And it is a period between closure of semilunar valve and opening of the AV valve. Semilunar valve, AV valve, both are closed for a while. అంటే ఆ షార్ట్ పీరియడ్ ని మనం ఏమంటున్నామంటే ఐసోవాల్యూమెట్రిక్ రిలాక్స్. ఇట్ ఈస్ రిలాక్సింగ్ బై క్లోజర్ ఆఫ్ బోత్ ద వాల్వ్స్, ఏవి వాల్వ్ అండ్ సెమిల్యూనార్ వాల్వ్. ఆ షార్ట్ పీరియడ్ ఏదైతే ఉందో దాన్ని మనము ఐసోవాల్యూమెట్రిక్ రిలాక్సేషన్. వాట్ అబౌట్ ది ప్రెషర్ ఇన్ ద వెంట్రికల్ నౌ? Decreased than atria. Decreased than atria. Now come on, rapid and slow filling, ante kada. When the pressure is dropped than atria, AV valves are open up and first rapid inflow will be there, later slow inflow will be there. Okay, danni manamu rapid inflow phase. Intraventricular pressure is less than intraatrial pressure. Hence AV valves open, blood flow from atria to ventricle at a faster rate. Ikkada some sound, it produces some sound, that turbulence due to rapid flow producing the what heart sound, ma? What heart sound, everybody? Is it audible? Second heart sound is audible. Audible to what? Stator. First, second heart sound are lub and dub. The third is, there is no like lub and dub for the third heart sound. Okay, and there is an instrument called, with that instrument only you can identify it. Phonocardiogram, third and fourth heart sounds. You can make out the third and fourth heart sound with the phonocardiogram. And the next, diastasis. What is the meaning of the diastasis, Nana? Slow flowing of the blood. Increase in the intraventricular pressure, blood flow from atria to ventricle become very slow, very static. Static means stagnant. And final stage is atrial systole. Again atrial systole begins. Atrial systole is a last phase of ventricular diastole. This point already I told you with the atrial systole, how much percentage of the blood is the ventricles are filling? 25% of the, so 5 phases are there in the ventricular diastole. Name the 5 phases, children. Protodiastole, isovolumetric relaxation, rapid inflow, diastasis, atrial systole. The story started with atrial systole and ended with the atrial systole. What is the duration of atrial systole? 1 second. 0.1 second. ఇక్కడ చూడండి, and during the cardiac cycle, and not only changes occur in the chambers and blood, also producing the sounds. What do you named them? We have noticed 4 heart sounds, right? How many heart sounds are there totally? And can be recorded? Phonocardiogram. First heart sound represented by S1, S2, S3 and S4. What is the cause for first heart sound? Where does it occur? Beginning of ventricular systole. Second heart sound is caused by? It occur at the end of third heart sound, ventricular filling. Fourth heart sound caused by atrial systole. Atrial systole, fourth heart sound. Atrial systole, fourth heart sound. Okay. Exam lo, the same thing comes. You should write this way. What are the differences between first heart sound and second heart sound? Any question vastund. Is a 5-mark answer. You should note the differences between these two. HS1 anna, S1 anna, both are same. What is the cause for the first heart sound? Second heart sound. Character of the first heart sound. Low pitch and loud. And second heart sound. High pitch and sharp. It produces lub and this produces dub. Duration of the first heart sound. Longer. Duration of the second heart sound. Sight of the first heart sound. mitral and tricuspid area. Site of the second heart sound, pulmonary artery and aortic area. Correlation, R wave of the ECG is correlated with first heart sound. Correlation of the second heart sound, end of the T wave of the ECG produces the second heart sound. These are the differences between first and second heart sound is a 6-mark answer in the examination. అక్కడ explain చేయడానికి ఏం లేదు, you have to read it. That's all under the heading like cause, character, duration, site and correlation. Okay, ఇందులోకి వెళ్ళి వైవ్ అడుగుతాడు. ఫస్ట్ హార్ట్ సౌండ్ ఈస్ కాల్డ్, ఇదే సేమ్, బోత్ ఆర్ సేమ్, బట్ హియర్ ఐ వాంటెడ్ టు జస్ట్ ఇట్ విల్ బికమ్ రివిజన్, if I teach second time, that's why both I kept. ఇక్కడ 4 హార్ట్ సౌండ్స్ ఉన్నాయి, ఇక్కడ 2 హార్ట్ సౌండ్స్ డిఫరెన్సెస్ మాత్రమే మనం చదివాం అంతే. ఓకే, టోటల్లీ 4 ఆర్ దేర్. Yes, these are the areas. This area is known as aortic area. Remember, like Andhra Pradesh, pulmonary area, Andhra Pradesh, immediately pulmonary area, aortic area, tricuspid area, Telangana, okay, in the 5th intercostal space towards left side, okay, beside, in the same 4th, 5th intercostal space beside the and tricuspid area, Madhya Pradesh mitral area. ఈ ఏరియాస్లో మాత్రమే we hear the heart sounds. We hear the heart sounds in 4 areas. First heart sound in the Andhra Pradesh, A and P. Second heart sound due to the closure of tricuspid area and mitral area. ఓకే, అది గుర్తుపెట్టుకోండి. ప్రాక్టికల్ రివిజన్స్లో, ప్రాక్టికల్ ఎగ్జామినేషన్లో విల్ ట్రైన్ యూ హౌ టు సీ ది హార్ట్ సౌండ్, హౌ టు know the heart sounds. Am I right? You know here what are the areas? What are the areas? Aortic area, pulmonary area, mitral area, mitral later, tricuspid area, later mitral area. These are the areas. Okay. So, what is the meaning of hemodynamic changes? Blood flow, volume, pressure. Okay, dynamic changes means blood is flowing through the blood vessels with different pressures, amount of the blood with a different volume. Am I right? So these are all together called dynamic changes. What are they? Dynamic change. What are the main dynamic changes? Atrial pressure curve, ventricular pressure curve, aortic pressure curve, ventricular volume curve. We are learning pressure curves and volume changes. Pressure curves and volume changes. Amen. Tell me. This was taught in the morning to you. Madam told me. And can you recognize what is it? Intra-atrial pressure curve. Ma'am said in the morning, it seems, I asked her, JVP, jugular venous pressure, same curve. Remember, 3 positive waves and 2 negative waves. What are the 3 positive waves? AVC are caused by increase intra-atrial pressure. What are the 2 waves, negative waves? X and Y. X and Y are caused by decrease in the intra-atrial pressure. A wave is due to what, Nana? A wave is due to atrial systole. C wave is due to bulging of AV valve into the ventricle during isovolumetric contraction. V wave is due to filling of atria after the closure of the AV valve. JVP is very important. JVP representing your atrial pressure changes. Atrial pressure changes. This is the curve. AC and V. AC, V are positive అని ఎందుకు అంటున్నామంటే పైన the graph కి పైన ఉన్నటువంటివన్నీ positive and below are the negative. So AC, V are the positive one and X and Y are the negative one. What are these AS, ICP, MEP, REP? Subdivisions of the ventricular systole and ventricular diastole. ఒక్కొక్క దాంట్లో చేంజ్ ఎలా అవుతుంది ఏ. సో ఇక్కడ ఏ వాట్ ఈస్ ద కాజ్, ఏ ఇస్ ఫార్మ్డ్ డ్యూ టు వాట్ అండ్ డ్యూ టు ఏవి వాల్వ్ క్లోజర్ ఎక్కడ జరుగుతుంది, ఏట్రియల్ ఆఫ్టర్ ఏట్రియల్ సిస్టోలీ. సో యూ షుడ్ కోరిలేట్ విత్ దిస్. Am I right? Am I right? Intra-atrial pressure changes. Okay, intra-atrial pressure changes can be studied by what curve, mama? Jugular venous pressure, JVP. Jugular venous pressure. What are the positive waves here? And what are the negative waves? A is caused by A, C is caused by V is caused by A, C, V. V is caused by all the three. A, C, V are caused by increase in the intra-atrial pressure, and X and Y negative are caused by yes. This is how you should write in the exam, draw the graph and explain about all the positive and negative waves. Now coming to ventricular pressure curve, particularly left ventricular pressure. Left ventricle lo ఏ artery ఉంటుంది? What artery is there in the left ventricle? Left ventricle lo what artery takes its origin? Aorta. Very good. Aorta nena? Sure. Aorta. Aorta lo pressure ఎంత ఉంటుంది? Maximum pressure ante. Okay. Maximum pressure ఎంత ఉంటుంది? 120. Maximum 120 కదా. BP, your BP ఎక్కడి నుంచి వచ్చింది? అయోటా నుండి ట్రాన్స్మిటింగ్ టు ఆర్టరీస్. 120 maximum pressure. 80 is the minimum pressure, the diastolic pressure. Okay. So ఇక్కడ during isovolumetric contraction phase, what happens? Pressure rises steeply due to raise in the tension. Maximum ejection phase లో ఏమైందమ్మా? Pressure reaches to what? 120. Okay, as ventricles contracting with maximum force. Reduced ejection lo ఏమైంది? What happened in reduced ejection phase? The pressure is less during this phase. Okay, end of the pressure it becomes 80 and in the maximum it will be 120. Aorta lo 120 maximum pressure, 80 is the minimum pressure, which is reflecting your BP, blood pressure. That is the pressure in the aorta. Okay, everyone? Okay, what is the blood vessel here? We are talking about aorta. Exam lo adugutadu aorta lo what is the pressure? Explain the pressure in the aorta. Draw this graph and explain in the what is in which phase what kind of the changes that is happening. Should explain. Coming to aortic pressure curve. Aortic pressure curve during diastole of the heart. Aortic pressure maintained 80. Diastole 80 అని చెప్పాను, systole 120 అని చెప్పాను. So this curve is aortic pressure curve. So these are the semilunar valve open, semilunar valve closes, reaching the maximum 120 and it come down to 80 are the aortic pressure changes. Now we'll talk about volume. Volume ఏమవుతుందనా? What happens to the volume? Volume, how much amount of the blood is there in the body? Correct, 5 to 6 liters. 5 to 6 liters లో end diastolic volume ఏమవుతుంది? Stroke volume ఏంటి? End systolic volume అంటే ఏంటి? What is the end diastolic volume? During diastole ventricular volume increases. అంతే కదా, diastole is what? Expanding of the ventricle. అప్పుడు ఏమవుతుంది? What happens to the volume of the blood increases. That becomes maximum at the end of the diastole. This is known as end diastolic volume, which is about 130 ml. Very important viva question, multiple choice question. End diastolic volume. Stroke volume, amount of the blood ejected by each ventricle during each systole, that is about 80 ml, is known as stroke volume. End systolic volume, end of the systole, minimum amount of the blood remaining in the heart is called as end of the systole. The first two things are very very important. End diastolic volume చాలా important. Rather systolic, end diastolic volume is very important. End diastolic volume. ఇక్కడ end systolic volume, end diastolic volume 130 ml. 130 ml is the normal. And volume alters with a different stage of ventricular systole and ventricular diastole. Volume wise, lot of changes are there. Is known as ventricular volume curve. Ventricular volume curve. Right. ECG already it was taught. Normal ECG is produced. Why is laughing? Ask him. Get up. Third. Yes, beside you. Amen. Go break kavalna. Yeah, ECG over. First part is ECG over. Normal waves are formed. What are the normal waves, Amma? P wave, Q, R, S, T. Yeah, complex and T wave. What is the cause for the P wave? Atrial depolarization. QR is complex. Ventricular depolarization. T wave. Along with the heart cardiac cycle, normal ECG is produced. That is what I would like to say. What is it? దీన్ని మనము ఏమంటున్నామంటే విగ్గర్స్ చార్ట్ అంట. దిస్ చార్ట్ ఇస్ కాల్డ్ విగ్గర్స్ చార్ట్ విచ్ ఎక్స్ప్లైన్స్ అబౌట్ ఆల్ ది ప్రెషర్ చేంజెస్, అయోటిక్, atrial pressure, ventricular pressure, volume changes, ventricular volume, electrocardiogram, phonocardiogram, heart sound, ante from one beat to other beat with all the subdivisions and all the volume changes and pressure changes, ECG changes and heart sound are recorded in one diagram, in one beat to other beat, all can be explained, is known as Vickers chart. Explain cardiac cycle with the Vickers chart ante ee diagram kuda veyalsi. Okay, just mention Vickers chart. Later you can draw it from your textbook. Vickers chart. What is the chart?
ఇంతవరకు చేరిన మొత్తం నగదు 34.8 మిలియన్ బాండ్.
ఏం అవసరం లేదు. ఇది చూడండి అన్న, ఈ డయాగ్రామ్ చూడండి. వాట్ ఈస్ దిస్ డయాగ్రామ్ కాల్డ్? ఈ డయాగ్రామ్ చూడండి. హౌ ది డయాగ్రామ్ ఇస్. ఈ డయాగ్రామ్ కి ఒక పేరు ఉంది, హిస్టెరెసిస్ లూప్ అంటారు. వాట్ ఈస్ దిస్ లూప్ కాల్డ్? Hysteresis loop. This representing it is a relation between pressure and volume without any time is called, and in the of the left ventricle is called hysteresis loop. Repeat, what did I tell you? Not important for you, it is a PG part. Make important kaadu, but I should tell you, no, that's why I'm telling you. What is the name of the loop called? Yeah, how to define hysteresis loop? Relation between pressure and volume of the left ventricle not depending on the time is known as ఇక్కడ అమ్మ హిస్టీరియా కాదు, ఇక్కడ ఏమేమి కాంపోనెంట్స్ ఉన్నాయి? A, B, C and D కాంపోనెంట్స్ ఉన్నాయి. Am I right? What ABC representing?
Excuse me.
ABC representing what? Ventricular diastole. And the CDA represents what? Ventricular. We are talking about only ventricle. And what AB represents, ma? Correct. What is BC represents, Nana? Phases of the ventricular filling, rapid filling, slow filling, last rapid filling. Okay, end of this, all valve, mitral valve get closes. What C represents? And pressure. And what CD represents? What DA represents?
Excuse me.
Ejection phase. Am I right? Okay, so and A represents what? What A only represents? End of systolic pressure or volume at the point of the time. Okay, అంటే cardiac cycle బాగా అర్థం చేసుకుంటే you can go deep into this cycle, hysteresis loop, which is a part of PG, but you should know the terminology at least. అంటే one loop లో all changes can be studied with the components of only 5 or 4 A, B, C and D. A, B, C and T. What is this loop called? Right. Okay, now what are murmurs? Murmurs also over for you. What are murmurs? Abnormal. Normally blood flows in the blood vessel in a what way? Laminar flow. ఏదైనా అడ్డం వచ్చినప్పుడు any orifice getting obstructing the laminar will become turbulent. Appudu murmurs are produced. They are called turbulence in the normal laminar flow of the blood is heard as what? Murmur. During ventricular diastole, the flow of the blood through the stenosed mitral valve producing the murmur. What is the meaning of orifice and stenosis? Orifices are what? The valve between atria and ventricle. Stenosed is nothing but narrowing of the ventricle, narrowing of the orifice. If the narrowing of the orifice producing the blood produces and it will become laminar to turbulent. When the orifice size reduces, stenosed, and it produces what? Murmur. Different murmur. Mitral stenosis. What is the meaning of mitral stenosis? Mitral valve stenosed. What murmur is produced? And mitral regurgitation. The meaning of mitral regurgitation, when the blood from ventricle and coming back towards atria producing sound. What is that murmur called? Systolic murmur. Aortic stenosis. When blood enters into aorta and aortic valve stenosed, what murmur is that? Systolic murmur. Aortic regurgitation, diastolic murmur. This is how the murmurs are produced. Okay, murmur anta important terminology. Stenosis, murmur, these all are different types of the murmurs are important for examination. Yeah, ఇది చాలా important అన్న. ejection fraction. The meaning of the ejection fraction is percentage of total blood volume ejected by ventricles during each beat. Some related terms like ejection fraction are there. They are end diastolic volume, end systolic volume. What is end diastolic volume? Important. ఇంత ముందే చెప్పాను నేను, end diastolic volume is very important అని. 130 ml or 120 ml end of the blood within the ventricle at the end of ventricular filling, end diastolic volume అంటాం. End systolic volume 50 ml volume of the blood remaining in the ventricles after the ejection phase is over. What is stroke volume? Stroke volume Viva question again. Viva define stroke volume 100. Volume of the blood ejected during the each ventricle systole. It is the difference between end diastolic volume and end systolic volume. Both the difference between these two is known as, and approximately stroke volume 70 ml. One end diastolic is more important. Stroke volume is also important. These are the related terms to ejection fraction. Define ejection fraction, Nana. Yeah, there is a calculation for ejection fraction. This is the calculation. It is calculated by stroke volume into end diastolic volume into 100. Okay? So is the clinical significance of end diastolic volume. It is used to assess the cardiac function. It is less than 55, indicating of the cardiac dysfunction. Less than 55, that's all. And your heart is not functioning properly, another indication. End diastolic volume. Chala important. End diastolic volume is very, very important indicator for cardiac dysfunctioning. Okay, so with that, abnormal ECG already over. Tell me what are all we have done today? Not ECG. I'm not talking about ECG. Only cardiac cycle. Define cardiac cycle.